Hi, my name's Shani Collins, and I'm a student at Pacific College of Health and Science in the Public Health Education and Promotion program. Today I'll be talking about breast cancer and public health. One study states that breast cancer, the most frequently occurring cancer in women, is a major public health problem, with 1,384,155 estimated new cases worldwide, with nearly 459,000 related deaths. According to American Cancer Society, 1 in 8 women in the United States will develop breast cancer in her lifetime. And it has been predicted that the worldwide incidence of female breast cancer will reach approximately 3.2 million new cases per year by 2050. A review which aimed to investigate the incidence and mortality rates of breast cancer and to identify the risk factors for breast cancer in the world found that common risk factors include being female, reaching the age of menopause, having a mutation in the BRCA1 and BRCA2 genes inherited through the dominant autosomal method, family history of breast cancer, alcohol and tobacco use, diet and nutrition, physical activity, vitamin D, air pollution, and socioeconomic status all contribute to the likelihood of developing breast cancer. Another study says epidemiological studies suggest that addressing socioeconomical issues is extremely important. They point out the need for all women to have equal access to medical care from screening to advanced treatment. There are some interesting public health campaigns against breast cancer. One is Bring Your Brave campaign. According to the CDC, they launched Bring Your Brave in 2015 to provide information about breast cancer to women younger than age 45. It's a campaign which tells real stories about young women whose lives have been affected by breast cancer. Through sharing their stories, these women are able to spread awareness about the risk of breast cancer in young women, explain some methods for preventing it, and inspire other young women to talk with their healthcare provider about breast cancer in order to live a breast-healthy lifestyle. Another public health campaign I found rather interesting is the International Breast Cancer and Nutrition (IBCN) project. According to their website, the mission of the IBCN project is to foster the development of a community of scientists across disciplines and public health experts dedicated to research on the primary prevention of breast cancer. Their goals are to 1. Identify the potential links among diet, epigenomic characteristics, and breast cancers. 2. Create new models for understanding the individual and environmental factors that contribute to breast cancer incidence. 3. Design a primary prevention model that can be generalized to examine individual and environmental factors responsible for the incidence of other chronic diseases. 4. Identify targets and strategies to prevent breast cancer development. And 5. Translate discoveries to global communities. I thought the Bring Your Brave campaign was a great idea because it spreads awareness of the issue. It makes it relatable, and it provides some hope by pointing out that people are surviving breast cancer and giving tips from their own experience. And I really liked the idea behind the IBCN project because it could be a great resource one day for people who either have breast cancer themselves or maybe they're people studying how to prevent breast cancer for themselves and other people. Regarding the impact of public health on incidence, One study found that promotion of breast cancer management contributed to a significant reduction in mortality rate of breast cancer. This shows that public health messaging can be an effective measure in breast cancer prevention.